Have you been struggling with urinary issues related to a big prostate and you're weighing up your treatment options? It's possible that you've heard of Rezum and UroLift, but which one is right for you? Is one better than the other? In today's video, I'm going to break down the key differences between Rezum and UroLift so you are aware of the pros and cons of the two different pathways, and you are then equipped to make the decision that you think is best for you. Hi, my name is Dr. Charles Chabert. I'm a urologist and director of the prostate clinic located on the Gold Coast in Australia. I have been counseling and treating men with urinary issues related to BPH for the last couple of decades and have extensive experience with both Rezum and UroLift and understand the nuance of which man and which prostate is better suited with which treatment. If you stick around to the end of the video, I'll highlight for you the ideal candidate for each of those treatment modalities so that you might be able to choose the treatment that you think is appropriate for you. As always, if you get benefit from this video, please give the video a thumbs up, subscribe, and if you've got comments or questions, please leave them in the comment section down below. Okay, let's get into it. So what is Rezum? In essence, Rezum is a newer treatment that uses steam to treat prostate tissue. It is a type of minimally invasive prostate treatment. For many people, it can be done in an outpatient setting, or patients spend a minimal period of time in hospital. Rezum is a minimally invasive form of prostate treatment. Here in Australia, it tends to be performed in hospital under either a light anesthetic or potentially a general anesthetic. I know that there are regional variations, and perhaps if you're in the UK or if you're in the United States watching this video, this treatment, Rezum, is often performed in an outpatient setting under local anesthesia. In essence, steam is delivered to the prostate via a telescopic camera. So this is placed through the urethra, and then steam is delivered directly into the prostate. Depending on the size and the shape of the prostate, a varying amount of injections or steam treatments are required. For the majority of people, there is some swelling of the prostate after the Rezum treatment is performed, and men do require a catheter for a period of time, but more of that later. If we look by contrast at UroLift, again, certainly in Australia, UroLift is performed under an anesthetic in hospital. However, the majority of people can be managed as day-only patients. Again, if you're in the States or if you're in the UK, it is possible that you could be managed under local anesthetic in your urologist's office and be discharged same day. So a subtle difference from a regional perspective, but both of these treatments aim to unobstruct the bladder by treating prostate tissue to try and improve the way that men pee. Rezum does it by injecting steam directly into the prostate. UroLift, in essence, is a series of clips, or in effect medical grade staples, that are used not to remove prostate tissue, but actually to retract prostate tissue with a view that we pull this obstructing tissue off the urethra, relieve the obstruction, and allow men improvements in the way that they pee. Rezum, if you like, is a bit of a slow burner. There's injection of steam into the prostate, and each injection is about 1 cubic centimeter. So the challenge with Rezum is that immediately after the treatment, there can be some swelling of the prostate, which can actually further restrict the flow of urine. And this is really why some men, many men in fact, require a catheter after the treatment to accommodate for that swelling and potential worsening of their urinary symptoms. In my practice, most men following Rezum have a catheter for around 4 days. However, that is very dependent upon the number of injection sites that are utilized. The bigger the prostate, the greater the number of injections that are required, and the greater the degree of swelling for a longer period of time. That obviously needs to be taken into account when deciding how long a man requires catheterization for. If we look at UroLift, as I said, uses the deployment of essentially medical staples. Again, it's performed with a telescopic camera. Obstructing tissue is visualized at the time of a cystoscopy, and these clips are placed into the prostate to retract tissue to unobstruct. Most men following a UroLift procedure, if only the clips are utilized, can be managed same day. Most men don't require a catheter and can go home on the same day without a catheter. So one of the differences between UroLift and Rezum is that UroLift can facilitate a more immediate improvement in the way that a man pees. Now, you may have heard me talk before if you're a regular viewer of this channel, but urinary symptoms we break into obstructive and irritative symptoms. The obstructive symptoms get better first, and that is certainly the case with UroLift. And we expect men to notice an improvement in their flow, usually within the first few days after treatment. The same cannot be said for Rezum. And many men notice following Rezum no real improvement in the way that they pee for some 3 weeks after the procedure. Beyond that, they can experience a gradual steady improvement in flow, i.e. resolution of their obstruction, and a gradual steady improvement in their bladder irritability. Now, in my experience, UroLift, because we're actually placing staples into the prostate, compressing tissue and retracting it, can be associated with a degree of perineal discomfort after the procedure. And my experience is that UroLift can cause more discomfort than Rezum. One of the key differences between Rezum and UroLift really is the intrinsic way that the treatments cause a benefit or result in a benefit in urinary symptoms. Steam, high temperature, degrades prostate cells, and gradually with time, the body reabsorbs prostate tissue. And so what we see, if we were to look inside a man with a camera and have a look at his prostate many months after he had treatment, what we would see is that the previously identified obstructing tissue that was causing a blockage actually regresses, and we see a wide open cavity inside the prostate. With UroLift, we are not removing any tissue, we're merely relocating it or pushing it and holding it out of the way. One of the key differences also in terms of who is applicable for which treatment is that Rezum can be used on larger prostates with more complex shape, including those men who have a median lobe. Now, a median lobe is part of the prostate that grows and in essence pushes up into the bladder. I often describe it to men and say that the opening of the prostate, if you think of the prostate a little bit like a donut and we pee through the middle, a median lobe is where part of the prostate grows up into the bladder and can act like a ball valve to block off the outlet pipe. If men have a median lobe or if men have larger prostates, in my opinion, there's just too much obstructing tissue to be able to retract, i.e. pull out of the way and hold out of the way for a durable period of time. In my experience with UroLift, which is now approaching 12 years, it's an excellent treatment if men have a smaller prostate that is still causing an obstruction, but the nature of that obstruction, the technical term is that it's bilobar, meaning that the obstruction is just coming from both sides of the prostate and an absence of a median lobe. If men have that more simple configuration, they can be effectively managed with UroLift. The more complex, a larger a prostate, if there's a median lobe, and men are still interested in minimally invasive treatments, then Rezum is a better option. Now, when we're looking at minimally invasive options, the draw card for both of these really comes down to preservation of sexual function. And sexual function can be two things. It can be erections and it can be ejaculation. Now, when men have cavitating surgery, a green light, a TURP, or a HOLEP, almost always these men have retrograde ejaculation or a dry orgasm. And so many men do not wish to have this as part of their treatment plan. And that's what many men look for when they're looking at a minimally invasive option. Now, with UroLift, there is no risk to erections and there's no risk to ejaculation as long as only the clips are being used in that treatment episode. If men have Rezum, however, there is no risk to erections, but there is around a 5% chance that that man could experience either a reduction in his ejaculate fluid or potentially no ejaculate fluid, i.e. retrograde ejaculation. And that really, for Rezum, it really depends on the nature of someone's obstruction, where the injection sites are, and trying to keep those injection sites away from the pipes that facilitate normal ejaculatory processes. So as part of a key step when we're looking at who is suitable for which treatment, the majority of men in my practice are evaluated with a cystoscopy or a camera test before treatment to try and determine who is suitable for which treatment. Okay, if we look at which one provides the biggest improvement, well, crudely speaking, there is a similar magnitude of improvement that can be expected with both treatments. There is a industry standard questionnaire, something called an International Prostate Symptom Score, which is a 7-question questionnaire that men report themselves that gives us an idea of the severity of someone's symptoms. And crudely speaking, we expect about a 50% improvement in this questionnaire when we are using either Rezum or UroLift. If we look at durability, now durability, i.e. how long can we expect the treatment to last, really that comes down to the nature of someone's prostate size and shape and their obstruction, which treatment they're suitable for. But across the board, I would say that with Rezum, we see around a 10 to 15% chance that someone requires retreatment at 5 years. And with UroLift, that risk is a little bit higher, and that's in the order of 20 to 30%. It will, however, depend very much on the prostate characteristics themselves. Obviously, if we are pushing the boundary with who has which treatment, that will have a significant impact on the durability. Okay, now let's summarize with where we are. Rezum is a great minimally invasive treatment that, in my opinion, is better suited for larger prostates than those men who are suitable for UroLift. It can be used for more complex sizes and shapes, including a median lobe. The drawback, if you like, to Rezum is that the majority of men have a catheter for around 4 days, and the improvement is gradual beyond 3 weeks. If we look at UroLift, there is no catheterization that is required. The majority of men can come into hospital and be discharged on the same day. So we tend to experience a more significant, more immediate improvement in urinary symptoms, but it can be associated with a slight increase in perineal or discomfort in the area of the prostate. With Rezum, there is a small risk of ejaculatory changes. With UroLift, assuming clips only are used, there is no real risk to ejaculatory function at all. The risk of retreatment is lower, arguably, with Rezum than it is with UroLift. Okay, so in my practice, who would be an ideal candidate for having a UroLift procedure? Well, in my practice, it would be a man with urinary issues related to BPH, but his prostate would be around 40 cc's in size. There would be no median lobe, and the obstruction would be from each side or bilobar only. The ideal candidate for Rezum, again, would be someone who wants to preserve sexual function as a priority, and they may have a larger prostate up to around 80 cc's, but these boundaries can be flexible. bearing in mind the greater the degree that we push the boundaries of acceptance for who has this treatment, recovery and outcomes can vary. In my practice, Rezum up to around 80 cc's. It can be in combination with a median lobe, but that man needs to bear in mind that there is around a 5% risk of retrograde ejaculation. If you found this video helpful, as always, give it a thumbs up, leave a comment in the comment section down below. If you'd like to know more about men and prostate health, please have a look at this video or have a look at this video here. Until the next time, please take care of your prostate.